Welcome to the Town of Littleton Board of Health meeting for today, the 26th of March, 2025. In attendance, myself, Matt Wason, Dan Kane, Kevin Davis, and Kevin Baker, as well as our health director, Francis Daigle, and our health agent, Jim Greffy. Our first item on the agenda this evening is a 7 p.m. public hearing on 65 Bruce Street. I believe, John Boardman, you are part of that.
Good evening. Can you hear me?
Yes, we can.
Super. A little more familiar with the Teams format than the Zoom format, but I appreciate it. It's nice to be able to do these remotely, especially I'm a little under the weather today. So we have submitted a request under your regulations to allow the use of a retaining wall in a construction of a septic system for 65 Bruce Street. I'm not entirely sure. Oh yeah, I can share my screen, right? Show you.
You should be able to, yes.
Show you a picture. If you're seeing my screen, I've got a little color up of the plan. Does that make sense to you?
Yes.
Super. So right now we've got an existing dwelling located here on Bruce Street. It's down towards the end of Bruce Street, just before you get to the big farm.
Sorry, John, really quick, could you zoom in on that drawing part? We can see the whole width of your plan.
Sure. Is that a little better?
Yes.
Yep. So if you were heading down Bruce Street, sort of heading towards Harvard, there's before you get to the big farm area, there's a house there on the right. It's an existing 3-bedroom house shown here in brown. They've got a porch and a deck and an existing septic system that I believe was part of the original house construction. So it's probably pushing 25, 30 years old. It's tired. It's time for a new system. At this point, they're also looking to put an addition on the right-hand side of the property. So we are proposing a new septic system to serve what will be a 5-bedroom system at the completion of this. We've shown a primary here that will be a presby and a reserve area that's in fully compliant with Title V and the Littleton regulations. To limit the amount of grading that would spill into what is the buffer zone, because there's a wetland here at the bottom of the hill, we are proposing a retaining wall. Under your regulations, we are required to notify the abutters, which we have done prior to the use of the retaining wall, and come before you to request permission to utilize that retaining wall as part of the construction. And that's shown here in yellow. So that's what I'm here for tonight. I'm happy to answer any questions.
Before we go to the members of the board, comments from Francis and or Jim?
I'll point to Jim.
So I witnessed the soil testing out here, reviewed the plan. As Mr. Boardman says, they meet Title V with the, as it's set up now. They're actually grading out 15 feet. That wall is really, as Mr. Boardman said, is to catch the fill going into the buffer zone. Otherwise, the plan complies with your regs in Title V. So I don't see that it's really an issue.
Very well. Board questions? Kevin Baker?
I have no questions.
Kevin Davis?
I'm trying to look on the plan to see where the exceptions are. I don't see them.
Exceptions in particular.
There's the one that you're asking for a variance. Weren't you asking for a variance 10 foot from the property line for fill or something? No.
No,
there are no variances.
Correct. It's simply for the use of a retaining wall.
Okay. Thank you so much.
And the nice thing on this one is you're not even going to see the retaining wall from the street. It's really not going to impact any of the neighbors. The only person who's going to see it is the property owner when they're out on their deck, probably.
Okay, that sounds great. Thank you so much.
And Dan Kane, any questions?
Only question is why the presby as opposed to a traditional system?
The Presby has some advantages in terms of the size of the footprint and the grading. Allows us to keep the retaining wall a little bit smaller. Allows us to keep the costs down a little bit. So,
All right. Thank you. That's all I had.
I don't think I have any specific questions. I think, Francis, do we get receipt of the notification to the abutters?
We did, yep.
Okay. I have no additional questions. There are a couple audience members. If they are looking to ask about this particular public hearing, please raise your hand. Looks like no questions from the audience. Well, I don't have anything else. I guess since this isn't a variance request, but it is a public hearing, we would simply need a motion to say that they can go ahead with this project.
Correct.
I'll make a motion that we approve the. Go ahead, Jim.
No, you were just doing what I was going to suggest. Yep.
Okay. Keep me honest. Make a motion that we accept the proposed plan with retaining wall as presented.
Second that.
Motion and a second. Roll call vote. Kevin Baker,
Kevin Baker votes yes.
Kevin Davis,
Kevin Davis votes yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes. Thank you, John, for your presentation. Good luck with the project.
thank you. I appreciate your time tonight.
Next on our agenda is a 7:10 p.m. discussion further about basements and additions and room counts. It's technically 7:07. It's not a public hearing. We can either start early or have a member update for 3 minutes.
Start early.
I'm not exactly sure. So maybe let's just do an update on the Neshoba Valley Medical Clinic real quick.
Sounds good.
So I sent out an email earlier today regarding UMass Memorial submitting application to put a satellite location in Groton. And then also a draft from the Board of Selectmen, Select Board, sorry, to Maura Healy. I don't know if anybody got a chance. I should have sent it earlier. I apologize. But I just want to keep the board updated and understand the thoughts of the Board of Selectmen, whether there might want to be some action from the Board of Health as well to be considered. Yes.
So I read both of them, and does anybody else feel that the Board of Selectmen letter was disconnected from what I understand?
So let me
Or-
clarify. So that was the draft letter that they reviewed at the meeting. And I think that was before they received notice about UMass. So I think that was written before the notification. So not understanding that there was a proposed location being investigated. So I think the language in the letter is going to change. I just wanted to make sure that we got it ahead of this meeting to understand that the content is going to be very similar regardless. So looking for action, looking to work with everybody locally and creating more communication would be the focus of that. So whether the board wants to act in a similar fashion to support that in some kind of written form, that's something to maybe consider.
Yeah, we wrote a similar letter that was in a draft form when the hospital was closing down. So I think we can totally, in my opinion, I think the board should either co-sign with the select board or draft our own, in my opinion.
So one solution could be is we could nominate the chair to work with the Board of Health Director to write a letter of support for what the Board of Selectmen is proposing.
That works for me.
Did everybody get a chance to read the letters? Heads nod. Okay. I think my only concern with just outright support of the letter from the select board is that while it uses the phrase something like respectfully request, there's a lot of that. There's some content that I don't think actually is phrased, as respectfully. I understand the frustration, but I'm not sure if there's been a whole lot of communication. If I'm reading this, there's been none, but I'm not sure if there have been other interactions that I'm not aware of. I think having a response from our board would be hopefully beneficial to the cause. So I'm happy to help put something together. What do people think?
So that would be, we'll wait till we receive an edited letter from the select board and we can review it. It'll just streamline the process, because last time we had to wait to another meeting to be able to do something, and then it was like, 2 weeks later was kind of like a little 2 weeks late type situation. So once I get that letter, I can forward it to the chair and we can formulate a response.
Okay. I can email Mark and tell him that we're interested in co-sign and see what he says. Kevin, you had your hand up.
I was going to make a motion to nominate the chair to work with the health director to formulate communication from the Board of Health regarding the hospital.
Second.
Motion and a second for that. Roll call vote. Kevin Baker.
We didn't hear you, Kevin.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason votes yes. Very well. I will work with Francis and we'll see whether we can piggyback or need to produce something else. And we'll let you know. Is that it for now, Francis? Very well. Then we'll bring us back to our agenda item next to 710, discussion on basements and additions. At the last meeting, we had some good discussion around the draft that I believe Kevin Baker wrote, and thank you for doing that. And lots of good thoughts and lots of good ideas, and I don't think we landed on something specific. Kevin Davis is going to do some follow-up as well. But Francis informed me that Jim, you're dealing with some of these kinds of things around ADUs and such, and we would appreciate input you have as we kind of grapple with how do we make a subset of rules that the community and engineers and everybody can understand, but also kind of make sure we're protecting ourselves and we're not putting ourselves in situations that make it difficult.
Sure. So I think you've seen enough of these come before the board. You certainly realize the board, it's within the board's right to approve deed restrictions. And I think what we all struggle with, and as do you, is what seems to be reasonable for making sure the septic system and the use of the house match. We really don't want to get to a situation where you get in this mismatch and maybe too many people in the house or too much in the way of a use in the house. For us, as the field staff will work with the public each day, and at some point it would even be good if we had a document that provides people kind of a path for it, might minimize the number of times you need to see things before a board meeting, is to try to come up with a set of general principles. Right now, the board's policy, if it's one room over, we can sign off on it as for a deed restriction, and it's usually when there's more than one room being added to the house, or if we have questions, we send them to the board for the board to consider the project. I think some of the things we've discussed in the past, houses are based, the septic systems for the houses are based on, 2 people being in a bedroom and times the number of bedrooms, and rarely do we reach that level occupants in a house these days. It's rare that there's 8 people in a 4-bedroom house or 6 in a 3-bedroom house even. When you start to get down to 2-bedroom houses, then the number probably gets a little closer, and the system that kind of margin of error or comfort level is probably a little narrower. With the ADUs, the state has in the regulations that they've put together, really the regulations are really a policy that they're kind of enforcing on the state to say, hey, look, we need more dwelling units. And so they've kind of said any other regulations other than kind of the state minimum regulations are considered either prohibitive, and this is language from the regulation, or unreasonable. So something like Title V is not considered unreasonable because that's the standard regulations that you would have to follow if you're building a new single-family house in an area where single-family houses are allowed. But some of the local regulations, unless the state felt that they met the municipal needs for those particular things, might be considered unreasonable regulations. So as you're looking at these ADUs, and we've had a couple requests come in, and so fortunately the state DEP has actually in presentations to local health officials, kind of given us an outline of how we as public health should address these ADU units. And I don't know if you want to kind of go into that now. I'm happy to do that. Or so one of the things that was kind of, I guess it was happy to see, but they, again, because it's policy, this ADU regulations policy essentially, I'm sure the state has told Department of Environmental Protection that, we want to make sure these things can happen. And so some of the things we struggle with saying, hey, look, at an ADU might have 3 rooms in it, like a bedroom, kitchen, and a living room. For the purpose of the design of the septic system, we have been told by the state that you add the bedroom to the bedrooms in the house. And that's how you come up with whether the septic system flow, matching up whether the system and the number of bedrooms matches. So we're not necessarily looking at room counts, which we're very used to doing when we're looking at additions. So that was kind of the first thing that opened our eyes to that. And that ties back to deed restrictions, so kind of keep that back in your mind. I think a deed granting or not being able to, your board granting or not granting a deed restriction still fits within what are considered reasonable regulations because it falls within your authority under Title V. So it's not like you have a local reg that you're using here. It's not. So if you were looking at a house, I don't know, say that had 10 rooms total, and maybe 3 of them in an ADU and 7 of them in the 4-bedroom house that was there, and the number of bedrooms matched 4 bedrooms for the system. The state would consider that it being reasonable that you might grant a deed restriction to allow that ADU to go on that house, even though if we did the room counts 10, they'd need a septic system for a 5-bedroom house. I'm not sure if I'm confusing it. They really want to.
I followed you, but right there at the end, you said that the state would consider that reasonable that we apply the deed restriction, but they would not consider it reasonable if we said, no, you can't do that at all.
No, and so we're waiting for the stuff in writing. So the woman, the engineer from the state, the woman who presented, made it clear to the Board of Health folk in the room that you as a Board of Health do not have to accept deed restrictions. But because Title V allows you to accept them, that would certainly be a reasonable approach. Again, if you look at the regulations, they're really trying to develop additional dwelling units. And so they're looking at trying to remove what they would consider prohibitive or unreasonable barriers to those happening.
So my initial instinct would be this isn't really going to impact us very often because I'm guessing that we don't have a lot of properties with systems that are that oversized that they have spare bedrooms, because most of our 4-bedroom houses have 4-bedroom systems. Therefore, adding anything would be a 5th bedroom and potentially deed restriction off the table, even because we're even admitting it's an extra bedroom.
So I would agree with you on that. But again, she went through some of the examples. Let's say you have, I don't know, a typical colonial where you have 4 bedrooms upstairs. The rooms may be a little bit smaller, but in conjunction with putting an AD on, maybe for your parents, maybe a couple of the rooms upstairs, bedrooms get combined to make bigger rooms, which is something we see a lot. I mean, the size of bedrooms since I was a kid have gotten much bigger than what people can seem to survive in bedrooms these days. So, so there again, the goal is to end up with the right number of bedrooms for the size of the septic system. You might modify an existing dwelling to allow an ADU to be either added to the house or added as a standalone on the site.
Yeah.
So some other things that they talked about at the site was what some of the questions we had is if you have a house that was built, let's say prior to the current iteration of Title V, which was enacted in 1995, they're considered non-conforming systems according to the state. Not that you can't have them, they just don't meet today's regulations. And the town is full of non-conforming systems because you have housing stock that's all different ages. So the approach for an ADU on a site where you might have a non-conforming system, so pre-95, if the number of, so a Title V inspection may need to be done as part of that. And if that Title V inspection passed and they were staying within the number of bedrooms, that may be an acceptable thing to do, as long as they have a 2-compartment tank, which you have required for quite a number of times. So even when we do upgrades to houses that just need a tank, we're putting in 2-compartment tanks. So some of that's already happening, and that it meets the nitrogen loading for the site. And you have a lot of zone 2s or interim head well protection areas in town. Those are areas that are considered nitrogen sensitive. Think of all your well areas that contribute to your town wells. So we would have to look at that as kind of an additional requirement for that. Conforming systems, again, as I mentioned, if you have Coburn Street, I think is an example of a street in town where I know the houses, I believe they were all designed when the board had different regulations that were very strict for the number of bedrooms. So a lot of those houses were overbuilt. Those are probably houses where they can add the bedrooms and the system's already designed for it. The only thing they may need to do is add a 2-compartment tank to it. So again, they've kind of split how you approach these things, conforming systems, so anything 95 and forward, non-conforming systems, anything before. With the non-conforming, Title V inspections are required. If it passes and it stays within the design flow that permit was issued for, that could be acceptable. If they're adding a bedroom to it, the non-conforming system would need to be upgraded. So, and again, there's going to be lots of these. They present something to you, and you say, well, what do you think about this? And so it's a matter of going through, is it conforming? Is it non-conforming? Are you adding bedrooms? Are you not adding bedrooms? Did it pass? Did it not pass? Even a non-conforming system where you don't change the number of bedrooms, you could add the ADU and you could upgrade the septic system as if it were a repair. So there's a bunch of different iterations. It makes sense once you look at the code and how the code handles any other law. But it's just going to take some thinking through. So I think the biggest takeaway is in your room count thing is with the ADUs. And again, this probably is going to be tested legally all over the state, I'm sure, when somebody tries to push the limits of it. We're not looking at room counts necessarily to determine whether the septic system capacity is acceptable, but you may want to consider deed restrictions on those so you can allow the use, because there's, even though there's maybe too many rooms, and that would normally kick something into a larger septic system because of the room count.
Well, yeah, that was going to be my other question of clarification is they're suggesting if somebody builds an ADU that's, like you said, a little kitchen, a living area, and a bedroom, just count it as a bedroom.
So for the purpose of whether that septic system complies, you add that bedroom to the existing design, the number of bedrooms in the house.
Yeah, but you effectively kind of ignore the other rooms. And so then down the road, it's the person building the disconnected ADU that's effectively a 5-room, cottage that's 1 bedroom. But they say, but it's an ADU, so you can't look at. So are there other restrictions on how big an ADU can be so that we don't get into trouble with that?
So the ADUs by right, which is what everyone heard when they heard ADU is, I can do this. I think the way the language is written in the regulations, it can be either half the size of the existing dwelling or 900 square feet, I think, whichever is largest or whatever. So that's,
Okay.
yeah, I think 900 square feet, actually, whichever is smaller. I think the 900 square feet is kind of the max. And so to your point about standalones, you could have a standalone, and you could even allow a standalone with a one-bedroom system. They could put their own system in as long as everything else worked. Typically, a one-bedroom septic system is not allowed for new construction. But the state's rationale is because there's already bedrooms on the site, this isn't really and you consider the whole site, this isn't really a system for a one bedroom. You add this, yeah, they've done some gymnastics here to come to, again, they're trying to match up with the policy, I think. And I don't necessarily disagree. I just wish they had thought some of this out before maybe the regulations come out. So, and I'm waiting to see the stuff actually in writing. So,
do we have an estimate for when that's happening?
well, so I went to a seminar on the 4th of March, and they said 2 or 3 weeks to see the writing stuff in writing. Then I went to one on the 11th, and they said the same thing. I haven't seen it yet, so it should be anytime soon.
Okay, let me open it up to the board as well. Other questions? Hands, anyone? No. Okay.
Yeah, that's kind of how I feel too.
Yeah. Just add some footnotes to that, those regulations.
No, and so what we did, we had a staff meeting in our office last Friday, and I went through and just kind of condensed the notes from the presentation on one piece of paper so we could all sit around the room and said, did we all hear the same thing? Do we all agree that that's kind of how your our approach is? And since we're dealing with so many towns, and each town's board's a little different on their, some of our towns don't have an issue with deed restrictions for just about anything. They're more concerned that it's on the record that the number of bedrooms are set on the deed, so that, again, that, truth in advertising is there. Other boards are, a little more restrictive on that. Some of our boards even had prohibitions against deed restrictions for accessory dwelling units, which they may need to change because I think the state would consider that a unreasonable regulation at this point.
Yep. Okay. Well, thanks for all that information, Jim. This is timely for what we're going through anyways.
Sure.
And next steps, we're still, Kevin Davis, you're working on a draft for our next meeting. Is that correct?
Yep.
Okay. Is that still on track? Still going to work?
Nope, because because of the account issue. So if you wouldn't mind sending me a copy of that, that would be lovely.
You talking to me, Kevin?
No, talking
Oh.
to Mr. Wason.
Okay.
What do I need to send to you?
A copy of what was presented at the last meeting. I think it was a Word document. Or maybe Francis could send it, or
Francis, could you send that to Kevin, please?
kdavisboh@gmail.com. Pretty please with sugar on top.
Yeah, I'll catch up with you.
Very well.
Thank you, sir.
Yeah.
Appreciate it.
You guys sort it out, whether it's the next meeting or the meeting after.
Yes, sir. Aye.
Thank you.
Welcome.
I got to get it all in before the end of my term. You have to get it all in before the end of your term.
I'm all set.
Okay. Any other points on basements and additions? Otherwise, we'll punt the discussion to the next one. Great. Next item on the agenda is our infectious disease decision support tool. Can't say that fast. One moment. Here is our update. COVID-19 XEC variant remains the most prominent, same as 2 weeks ago. Vaccinations at still 30%. I don't really expect this number to ever change much for the rest of the season as people get into now spring and summer and they don't think about vaccinations. Wastewater numbers are kind of the lowest we've seen in a long time, so that's a positive sign. And on the right, our Littleton weekly case counts have kind of slid back down from that bump around March 1st. So I like those numbers. Let's keep those case counts low. Good news on the respiratory virus front. Influenza has been dropped from moderate to low at the Massachusetts level. So that's good. Similarly, vaccinations for influenza, 50%. Doubt that's going to change very much for this season. And then lastly, RSV numbers continue to slide. They were a little over 3% last time we met. Now they're just above 2% as reported by the CDC. So cross our fingers that we are out of RSV season, and that's great. Arbovirus season has not quite started yet, so we'll get that reporting kind of reactivated soon. The other two pieces to discuss would be avian flu, which still kind of doesn't really have any update for us. No new cases going on around our area. Still, the closest cases are in Ohio. And then on the measles front, which has been talked about a lot lately, similarly, no major update there. Cases are still happening in multiple locations of the country. The closest cases we have are in New York. And the only thing I would mention there is that there is some guidance on many of us who couldn't remember the last time we had an MMR vaccine, for example. So the CDC has recommended new vaccinations, or sorry, the CDC and or Massachusetts, I'm not sure who mentioned it, but they're saying if you were last vaccinated before 1968, then you might want to consider getting another dose of the MMR. So if you are not sure when that was, but you think it might have been that long ago, please see your healthcare provider to see if they might recommend you get another dose. Otherwise, they're saying for the most part, people do not need to get another dose of the vaccine, that hopefully we still have good protection. If you have not been vaccinated, pretty please, for the sake of yourself and your family and your community, get an MMR vaccine. Any questions or additional input for anything I missed? Very well. That brings us to our 7:20 p.m. agenda item, administrative matters. We have meeting minutes from the 12th of February and the 12th of March. Have our members present had a chance to review those? I see a head nod. I see a head nod. We will start with February 12th.
I make a motion to accept the February 12th meeting minutes as presented.
Second.
Thank you. Motion and a second. And Kevin Baker was absent for that meeting. So roll call vote. Kevin Baker,
Dane,
Kevin Davis,
Kevin Davis, yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes. So the minutes for 12 Feb are approved. Brings us to the minutes for 12 March.
I make a motion to accept the meeting minutes for 12 March as presented.
Second.
Motion and a second. Roll call vote. Kevin Baker,
Dane,
thank you. Kevin Davis,
Kevin Davis, yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes. Minutes for 12 March are approved. Thank you, Francis and Megan, for getting these minutes turned around in rapid fashion so that we can remember that the meeting happened when we read the minutes. Wonderful. Last on our agenda item would be correspondence and board member updates. Francis, would you like to start with anything else you have?
I can't think of anything off the top of my head besides the medical center. So,
All right. Kevin Baker?
I was hoping we could put on the calendar to meet with the select board as we spoke about the other day, in some sort of consistent fashion, maybe quarterly. And if maybe Megan or Francis would be so kind as to get us on their agenda and to answer any questions they may have.
maybe we can talk offline. I just need to know what kind of setup you'd want to do and how much time.
We haven't done it regularly as long as I've been on the board. some of our senior members ever remember something regular with the select board?
I've never seen anything like that before.
Okay.
I've never seen anything like that.
I don't think any other boards do this setup unless there's an issue or basically, approach. We would like to talk to them for some reason, or they would like to talk to us or some other board for some reason. I'm not sure we've had anything regularly scheduled or anybody else really set up that way. So it would be a new thing, I think.
Well, maybe we can just get the first one on the books and then see how often they want to see us. But it was
Why do
requested
they
of
need to
us.
see us?
It was requested of us the other day that we communicate more with them and have open and transparent conversations, which we're happy to do. if they ask.
Kevin Baker and I met with members of the select board and town administration the other day to talk about our staffing plan and coverage for when our health director is potentially out of commission or on vacation or anything else. And out of that meeting came just a request that we try to figure out how to have a better connection between the Board of Health and the select board. So they threw out, why don't you come meet with us periodically? So we said, okay, if that's what you would like, then we can try to do that.
They could always come visit us. I believe the select board does in fact have liaisons to all the other boards and committees in town. I know we did have a select board liaison from the select board to us at some point. I'm not sure if they're still utilizing that model.
It's a good question.
I
I believe they have no longer been attending our meetings.
I would agree, but I do know they had that model in place for quite some time. I guess my only piece would be we are an independently elected body that we don't really, obviously I'm all for communication and transparency and collaborative practice, but I guess I have a slight philosophical concern with being beckoned before the select board to tell them what we're doing and communicate with them when really we are an independent board under our own authority under the state, that it really should be then therefore collaborative rather than us walking before them and telling them what we're doing and having them question of what we're doing. If we want to be collaborative and transparent, let's be collaborative and transparent rather than us going to their house and telling them what we're doing and then be questioned about it.
I agree, Dan. I do not consider it as something that we are being beckoned and are expected to present anything specific. I would see it as more as an opportunity to have open conversation / debate about problems we're having that they can help with or problems that they're having that we can help with. So I'm actually in favor of it being something where it's just on their agenda and it's a joint meeting for that period of time and we are all there. And if there are no issues to discuss, then that might be all there is. I don't want it to be a waste of time. I know it would take a lot of time to get all of us together with them, right? It's another thing to do, but like we said, we want to make sure we just have open communication lines. I have similarly asked them to feel free to email us whenever they have anything that they have a question about so that we can kind of further discuss it. Something that came up in the meeting that we were having, talking about staffing plans, was our fee schedule. They had some questions on our fee schedule and they were a bit out of left field. I had no idea we were going to be discussing our fee schedule at all. So that's the kind of thing that I said, well, if there are concerns like that come up, we also don't need a meeting. We can at least initiate something by email. And if by email, the chair designee feels that it's kind of getting beyond the scope of an individual, then let's bring it to a meeting that both of us can attend.
And the other thing that I heard too was that there were some comments made about how we were going to be doing our staffing plan that I think were factually incorrect. So I heard them.
Are we able to share any updates for the rest of the board about like where we are with our backup plan, our transition, how much workload Francis has taken over from Neshoba, et cetera, just so the board's aware?
I don't have any real update because I don't make any plans like that. And I think that was part of the question was I believe the select board feels that this board should be more involved in how that should all work. Which I felt it was more of an operational issue that falls better under the purview of, I would see, design by, health department working with town administration and approved by this board, as opposed to ideas generated by this board and handed off for implementation. So I'm not sure exactly which way that should really go. I'm hesitant to make plans that this board then imparts on other parties to operationalize, especially when our department is one and we don't get the budget to increase our department. It makes it very difficult for this board to come up with plans that cost money because there is no money in our budget for it. So I was pitching that ideally the any sort of plan design that comes out of this should really be originating ideally from inside the town offices, and that we are informed about that. Like I said, I'm not sure if that's really going to work well. So I think moving forward, we're going to have to keep a better eye on things and better tabs on things, just to make sure we're not running into roadblocks. Jim's here. I'll try not to put him too much on the spot. What I was told by town administration was that Jim was going to be taking to Neshoba Associate Board of Health at their board meeting tomorrow. Sorry, Jim, when's your board meeting?
It is tomorrow.
Okay, that's tomorrow. A proposal request from town administration on if they could arrange some structure where services were paid for, and I don't know the details. I haven't read any sort of proposal, but that's what I was told, and so we will hear what happens from the NABH meeting tomorrow if whatever proposal town administration put together is approved or not. If that is approved, then we have at least the makeup of a backup plan. If not, then we are back to an earlier square on the board trying to figure out, okay, what's the next opportunity to explore?
Maybe
Kevin, yes.
maybe I'm not grokking something. If that was put together by the town selectmen or board or whatever, I thought we were supposed to have like some say in what was going on.
Well,
As a
welcome,
board.
Kevin, to the confusion. Exactly. So I'm not sure exactly how it should play out, but I think nobody's really happy with how it did play out. So we're trying to be a little more open about it. I agree. I think that arrangements like that, like I described, I think plans should be developed internally to the town, brought to this board for approval, and then actioned. In this case, a plan was created, actions were taken, and we found out while it was going on and kind of late in the game, I think. So I don't have a lot more details. I'm not trying. I don't want to point fingers. I don't know where it started. I don't really care. I care more about how we're kind of making sure things are clear in the future, and that's part of why I want to meet with those individuals the other day. So that's the current stat. I think we're all on the same page now. I think we're all similarly informed. So, like I said, that's the next step, and so that's Plan B. And if that passes, great. If that doesn't pass, then we're going to have to talk more about Plan C. I think that should probably come to this board next time at our next meeting. No, but whichever happens, we should have on our agenda for the next meeting so we know whether we are discussing solutions or not, and this board can be informed about what the plan looks like. Is that fair? Okay.
Jim, I don't want to put you in any spot. Do you want to speak or no?
I can tell you that I had put together a proposal. Francis and I had talked about it. And again, I'm balancing providing our services to Littleton, to my board, who is saying we're a membership organization. Why are we doing this? So I was trying to get a middle ground that was palatable. Proposal that I sent up to town administration. They kind of countered it, and it's not something I'll mention it to the board, but it's more like fee for service kind of thing, per hour kind of thing, and that's just not something I think our board would accept. And so I'll convey that to town administration, but I'll mention it to the board just in case they.
Just to clarify that, the initial proposal is off the table and you're only presenting the town's counter, or will you present both proposals to the Neshoba board so that we have a clear understanding of which way they might go?
So I will present to the board what I suggested to town administration.
Okay.
And what they returned and kind of a response.
Perfect.
Again, I presented what I thought they might accept. So,
Thank you for that, Jim.
yep.
Not sure how we even got here. We're in the member updates. I think that might have been a question about something. But who is going? Does anybody remember who was talking? Francis didn't have anything else.
That was-
I think it
That was me. I
Kevin
just
Baker.
asked if
Kevin
we
Baker,
could
go
meet
ahead.
with I just asked if we could have a meeting with the select board. That's all.
Ah, right.
Yeah.
Troublemaker. Anything else, Mr. Baker?
That's it.
Kevin Davis? Dan Kane?
I don't have anything right now.
Okay. And Jim, anything else? Any other tidbits you'd like to share?
No, I can, Mr. Davis, if you're going to put together something, I can send you over my flow sheet for the ADU stuff. If you have questions, there's a bunch of abbreviations or stuff. So if you have questions, certainly give me a call. But it was, I gave kind of abbreviated summary of what I had put on paper. So,
That would be wonderful. Thank you.
okay.
All right. And I do not have any further updates or information. So that's all we got. Kevin.
Sure. I'd like to make a motion to adjourn.
I second that motion.
Motion and second to adjourn. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason votes yes. Thank you all for your attendance and participation. Have a good evening.